a young adult. So he is 23 years old. And I am sure a lot has changed since he was diagnosed to how things are with protocols around juvenile arthritis today. However, I do think this communication piece spans across time. So I'm really, really glad that we're addressing it, because I don't think it's something people talk about a lot. I really think about, especially when you ask me to speak on this topic, that families hold their child as their most precious gifts. And if something isn't going well for their child, they're obviously going to want to seek support and answers. And if it's medically related, you really trust that the medical professionals are going to know what's best for your child. But what you alluded to is that those communication breakdowns can cause additional stress, worry, sometimes even make you feel like you must have gotten something wrong in your explanation to the doctor because they can't figure things out. But the journey of juvenile arthritis in particular, sometimes it's really difficult. Many people who know our family know that this journey started for my son at 8 years old. Well, it wasn't for a lack of trying to get help, but it took us a year and 7 months to get a diagnosis. It took multiple specialists. It took multiple ER trips that the doctor, our primary, would say, go to the ER. So it wasn't like we were saying, oh, we got to go to the ER, maybe they'll have the answer. It was our own doctor saying, get in the car, take him to the ER right now. So you get to the ER and magically symptoms start disappearing before the doctor comes. And that happens we hear that from a lot of families. So the need for this is real, I think, even today. One of the issues that I believe contributes to this communication issue is that pediatricians are your first line of treatment. Some pediatricians have a background knowledge in rheumatological issues, but some don't. They may have only just briefly touched on it. So, their mind is going to go to what they know. And what they know is this child's growing. They might have growing pains. This child is probably doing activities that are physically related. Maybe they injured themselves. Children often are in sports. Oh, it might be a sports injury. So they automatically think to send you for treatment or maybe I should say radiology to try to exclude those things because those are the things that would be obvious in young children.
That really, you did such a good job of just framing exactly what the remainder of this show is going to be about. And that is really putting this topic on the table, telling you a little bit about maybe warning signs or issues with the communication that we're trying to address, and some action items where you can get involved if you are a person who is involved in juvenile arthritis, your family, your maybe a young adult, you've recently gone through these communication challenges. You are vital to helping us create the tools to fill these missing gaps. So at the end of the show, we will swing back and let you know how you can get involved in that. But first, let's dive back into the problem that Rochelle started talking about in this initial communication breakdown. And I think you really hit the nail on the head when you talked about the doctor told me to go to the ER. So we went to the ER, and I think what you and I, Rochelle, have really been zeroing in our own internal meetings on this project, because we're collaborating on it, is the need to create some kind of guidance for families to ask questions back. Or why am I going to the ER? What am I going to achieve at the ER? What if nothing happens at the ER? Because what we're realizing from just talking with other families is that that's where that derailment happens. Then, oh, well, okay, we're going to send you to the physical therapist. Oh, we're going to send you to orthopedic. Oh, and then you're following the doctor path. You're following the profession, which is correct, right? We're not suggesting in any way, shape, or form you shouldn't listen to your doctor, but we need to also be aware if there's signs of X, Y, and Z, and you're sent to a physical therapist, orthopedic, doctor, ER, and you're not getting the answers you need, we want to come in and help you. There's the missing gap right there.
Yeah, it's funny because a lot of what we're trying to help families with, and when I say we're, you and I and many others in the field that have somehow been touched by chronic illnesses and autoimmune issues, you're also dealing with personalities. So part of the communication derailment happens because of both sides. It's not us doing anything wrong or doctors doing anything wrong. It's us and our personalities and the way we learn to communicate, and whether we're a fight or flight kind of individual. And so I think by creating some sort of guidance for families to help make decisions about what is best for their child is really critical. Parents may have to get out of their comfort zone because you may have to advocate for your child when you're not even in a place where you're comfortable advocating for yourself. Children don't have that voice, especially when they're really young. So you're the person. I think that some of the things that start happening for families is they start seeing additional symptoms rise up. So sometimes what happens is one symptom will happen for one family as a first symptom, but it may not be the first symptom that happens for another. And so that's very confusing for both sides, the families and the doctors. But the common things that come up, and they don't necessarily come up in the same order for every child, is you may see very, very big change in fatigue, like the child is more tired. In little itty bitty kids, you might see them using a different motor pattern when they move. Either their gross motor or their fine motor might not be as precise as it used to be because they're favoring something that hurts. They may not be able to communicate it in words, but in their actions, you're seeing this shift happen in how they take steps or how they get up off the ground, or even in a little bit older kids, maybe even how they're doing their homework and how they're positioning themselves. They may not think to voice it or may not have the words. So as a parent, you have to look for things. Not that I'm saying you're looking for an illness, but you got to be in tune with your child. Children sometimes will develop rashes, and there's different types of juvenile arthritis, not to complicate things, but some children may develop facial rashes. Some children might develop a rash that is raised or not raised. Some kids, and this was the case for us, they would develop a rash that would move around their body. Like, how bizarre is that? And you're trying to tell somebody, no, that rash was just there. I swear it was. So, that's one of the big signs too, is to look for that. So stiffness, fatigue, rashes. Of course, if they say they're in pain or they point to a joint that's in pain, maybe feel it. Is it warm to the touch? Is it swollen? Sometimes it might feel a little squishy around the edges. So, you might want to take photos, take notes, because like I said, we'd get to the ER and the symptoms would be gone, where if you could show them the photo, it helps in the diagnosis. And of course, swelling is another thing that you will see happen.
Yeah, I just wanted to really reiterate what you just said about the jumping rash, because it can be the same with the joints or the enthesitis, the tendon pain. It's like And it can come and go for no apparent reason, which makes it extremely strange compared to an injury where usually you remember, but and even as adults with onset, we get, oh, you must have hurt yourself at the gym or whatever. So that theme carries through, but I can definitely see how in the children, oh, you were on the playground or you were, playing around with your friends and you got injured. But if that injury comes and goes and jumps into
Right.
other locations, that's also a sign.
Very much so. And I in the beginning of our journey, I was never one to say, could you explain to me why such and such is happening? So for instance, they would run so many labs and they would send us for x-rays, and some things in the beginning, nothing would show up. And so, I think it's fair to say to a doctor, what is this? What are these labs for? What are you looking at? What do they mean? Because that's not our world as a parent. You don't
Mm-hmm.
know, what is a CRP, what is, there's just so many. What does the ferritin mean? What is so I think feeling okay that's a fair question to ask a doctor. Could you please show me, even if they're normal, like what does that do in the body? Like, why would you even be running these labs? The other thing that families don't know until they've been in the journey a long time, it's kind of like those, oh, if only I would have known. You get the lab sheet, right? And
Mm-hmm.
you're saying to the doctor these things are happening, and then you have to schedule the lab, and your kid's got a busy life because they're in school or they might be in sports or whatever. So you're trying to figure out when to schedule it. Schedule it when your child has symptoms, because sometimes the labs only show disease activity when the child is actually in a flare. So if they're not in a flare and you go on a good day when your kid isn't feeling so bad, there may not be enough information for the doctor.